politicizing a public health matter can be it can be a good thing. And in the end, with HIV, we ended up, I think, in a pretty good space. Well, with HIV, learning from the past, let's see, we had a government program. The Ryan White Care Act is 30 years old and is a program that is in place that subsidizes health care for people who have no other way of paying for it, people with HIV, and their health care is subsidized under this federal grant to many places around the United States, including Trillium Health. We were one of the first in 1990 to receive such a grant, named after Ryan White, a young man who died of AIDS, who was highly politicized himself at the time when his diagnosis became known. Young man with hemophilia in those very early days. He was restricted from school, highly stigmatized. The COVID-19 pandemic has been over politicized, so it may take us a while to find our way with this and get it right. If there's legislation and political activity that is aimed at stopping virus spread, then politics is good. Bad politics that doesn't address that is just that, bad politics. I'm not going to name names, but the governor of Florida, as an example, has endorsed and promoted legislation that prohibits employers from requiring vaccination in their employees. So you're essentially legislating against public health. Where does politics end and public health begin? And we're redefining that border, and I'm not sure that we're doing it the best way possible. Politicians should leave the politics to the politicians and stay away from public health and let public health people do that. And legislating public health against something is counterproductive. And this won't be the last time we have this discussion either, because the next pandemic is out there lurking somewhere and will show itself at some time in the future. I don't know when. I can tell you, though, that respiratory viruses are unpredictable, and I have no idea what's going to happen with this one. I'd like it to go away, but we need to do a better job of vaccinating people and testing them and treating them, stopping virus spread before it goes away. Otherwise, it's just going to be a constant nuisance.